Welcome to our Explainer. Today, we're diving deep into Down syndrome. We're going to go from the fundamental genetics all the way to some truly groundbreaking research that is changing the entire landscape for the future.
So let's just jump right in with a number that really puts this into perspective. In the United States, about 1 in every 733 babies is born with Down syndrome. That makes it the most common chromosomal condition in the country, and it touches thousands and thousands of families every single year.
Okay, so what exactly is it? Well, at its most basic level, Down syndrome is a genetic condition. It's not an illness or disease. It's caused by having an extra copy of one of our chromosomes, chromosome 21. And that little bit of extra genetic material changes how a person's body and brain develop. Here's the game plan for today. We'll start with the basics. Then we'll look at the genetics behind it. After that, we'll cover how it's diagnosed and what health management looks like before we finish up with some incredible research that's happening right now.
All right, first up, let's build a solid foundation. To really get a handle on Down syndrome, we need to start with our own genetic instruction manual.
I've got a great way for you to think about this. Picture your entire DNA as a 46-volume encyclopedia for building a human. Each volume is a chromosome. Well, Down syndrome happens when, just by random chance, a person ends up with an extra copy of volume 21. So 3 copies instead of the usual 2.
So what does this extra volume actually look like on a genetic level? Let's zoom in and take a closer look at the blueprint itself. What you're seeing here is something called a karyotype. It's basically a photograph of a person's chromosomes, all neatly lined up. On the left, you've got a typical set of 46. But on the right, you can see the difference. See that little group labeled 21? There are 3 of them. That's trisomy 21, the most common form of Down syndrome. But, it's not always quite that simple. Well, the vast majority, about 95% of cases, is that classic trisomy 21, or every single cell has the extra chromosome. There are a couple of rarer forms. In translocation, a piece of chromosome 21 breaks off and attaches to another chromosome. And in mosaicism, only some of the body's cells have the extra copy. It's a genetic mosaic. So what causes this to happen? It's basically a random hiccup during cell division, called non-disjunction. The chromosomes just don't separate the way they're supposed to. And this is so important to understand. It is not caused by anything the parents did or didn't do. It is pure biological chance. And yeah, while the statistical risk does go up as a mother gets older, it can absolutely happen in any pregnancy. Okay, so that brings us to a really important question. How do doctors actually identify Down syndrome, a lot of the time before a baby is even born? It wasn't that long ago that finding this out meant pretty invasive procedures that came with some risk. But today's technology, it has completely changed the game, making the process way safer and much more accessible. So now, the whole process usually kicks off with a simple screening test called NIPT. It's amazing. It just analyzes tiny fragments of the baby's DNA that are naturally floating around in the mother's blood. This simple blood test is more than 99% accurate at flagging a high risk of trisomy 21. And only if that risk comes back high would a doctor offer a diagnostic test, like an amniocentesis, to get a 100% definitive answer.
All right, so once a diagnosis is made, the whole focus really shifts to lifelong health and wellness, because understanding and proactively managing care is absolutely key to helping individuals with Down syndrome thrive.
Get this, around half, that's 1 in 2 babies with Down syndrome are born with some kind of congenital heart defect. This is a huge deal, and it's why every newborn gets cardiac screening right away. Catching these things early allows for interventions that have completely changed the game, dramatically improving not just life expectancy, but quality of life. And it's not just heart conditions. There's a much higher chance of other health issues too. We're talking about hearing loss in up to 70% of people. Things like obstructive sleep apnea and thyroid issues are also really common. This is why proactive, regular checkups and screenings are absolutely essential throughout their entire lives. And this leads to something that is just so crucial for caregivers and doctors to understand. For a person who might have trouble explaining their symptoms, a medical problem, like an ear infection or a stomach ache, can show up as a change in their behavior, or maybe they lose a skill they once had. This makes observant caregivers and knowledgeable doctors an absolutely critical team. Okay, let's wrap up by looking ahead, because this is where things get really exciting. The world of Down syndrome research is moving faster than ever, and it's opening up possibilities that honestly used to sound like science fiction.
Okay, this is absolutely groundbreaking stuff. Researchers figured out that a specific receptor in the brain, called the CB1 receptor, is often way too active in people with Down syndrome. So a new experimental drug was designed to do just one thing: calm down that overactive signaling. This is a huge shift. We're moving beyond just supportive care to actually targeting the underlying neurobiology of cognitive challenges.
And the results from the first human trials? I mean, they're honestly kind of stunning. After just a month, people taking the drug showed real improvements in things like communication and daily living skills. Brain scans even showed that their brains were working more efficiently when doing memory tasks. This is a massive step forward, suggesting there's a real potential to improve cognitive function and independence.
So, from the basic building blocks of genetics to these new targeted therapies, our understanding is just exploding. And it really leaves us with this big question, right? As science keeps pushing the boundaries and unlocking all this new potential, how do we, as a society, make sure we're building a world that fully supports the health, the well being, and the inclusion of every single person?